Välkommen till Investalks som även publiceras med Dagens Industri. Idag välkomnar jag Ellen Donnelly, vd på Abliva, ett bioteknikbolag med fokus på att utveckla behandling av primära mitokondriella sjukdomar. Ablivas 2 kandidater har båda visat uppmuntrande resultat och bolaget befinner sig i en mycket intensiv och händelserik fas. Welcome, Ellen.
Thank you.
Please tell me a bit about Abliva, your strategy and your goals.
Sure. Thanks, Annika. We are at Abliva, we're trying to develop innovative treatments for patients suffering from a rare disease called primary mitochondrial disorders. Our goal is to build a leading global biotech company that's focused on mitochondrial medicine with all of the components you need in a biotech company with research, development, and commercial. So our goal really is to take the drugs from the lab bench to the patients that need them.
This is a fairly lofty goal. Why are you, a small biotech company in Sweden, well positioned to deliver on those goals?
It is a lofty goal, but we aim to achieve great things here. I think one of the things that differentiates us from other companies in the space is that we have a team that's been working in this area for over 2 decades. Both our CSO, Eskil Elmer, the founder of Abliva, and our CMO, Magnus Hansen, have been working in mitochondrial dysfunction for over 20 years. And that's pretty unique that you have a team like that. Eskil is responsible for the research part of the organization. So he's responsible for finding the candidates and finding the molecules. And then Magnus is the person that translates that into the humans. So he'll take the candidates into clinical development. Another thing that differentiates us is we're based in 2 countries. The group is actually based in Lund, but I've opened a US subsidiary in Boston, and so I'm based in Boston. So that'll give us the opportunity to both run the global study, have people on the ground in both the US and Europe, and then also expand when we need to start selling the drugs. I think the third thing that really differentiates us from the others is that we're trying to grow a portfolio of candidates. Our lead asset, KL1333, is a partnership with a South Korean pharmaceutical company, and that's the drug that's going to start phase 2-3 development later this year. We have an earlier drug, NV354, that is about ready for phase 1. And then we have some other ideas in the research labs as well. So trying to really grow a portfolio of programs for these patients with primary mitochondrial diseases.
And you're focused on developing new medicines for patients with primary mitochondrial diseases. I've never heard of this field. Tell me a bit about these patients.
This is a very rare patient. This rare disease affects approximately 125 people per million. So it's not unusual that you wouldn't have met a patient with PMD, but they're around. We know patients in Sweden that suffer from this. It's a debilitating disease, and it's caused by, interestingly, a mutation in your mitochondrial DNA. Most generally, it can also be caused by a mutation in your nuclear DNA, but that's a little bit less common. Your mitochondrial DNA actually comes from your mom. And the reason mitochondria are so important is they generate the energy you need in your body. And they are actually in every cell in your body except your red blood cells. So every cell has these mitochondria that are working night and day to give your cells enough energy to do what they need to do. And so in patients with primary mitochondrial diseases, something has gone wrong and that mitochondria isn't working as it should. And so you see an imbalance of important coenzymes in the cell, and this causes the cell to kind of shut down. It can't do what we need it to do. We actually call the mitochondria the energy generator of the cell. And when that isn't working, you can imagine you have a lot of different effects. And depending on which mitochondria and which target organs are affected, you may have a variety of effects. So we call it a rather heterogeneous disease. But one of the things that we've found in speaking to patients about their disease is that they all have some of the same common symptoms. Patients will suffer from fatigue. They'll have myopathy, which means it's muscle weakness. They'll have a hard time standing up or sitting down and walking. And that fatigue that we see is very, very different than the fatigue that we see if we stay up too late. We kind of call it mitofatigue. These patients just have a hard time doing anything, motivating to get up. It's just everything's exhausting. A shower is exhausting. We had one patient that said, I have to rest for 2 days after I send you an email. So these are the kind of things that we're targeting with our lead asset with KL1333, because we hear from the patients, these are my biggest problems, and our mechanism is well tied to those. So we will try to create more energy in the cells and thus create more energy in the patients. The patients usually start showing this disease shows up in early childhood. And then as it progresses, it gets more and more severe. And so there's no cure for this treatment for PMD right now. There's only one approved therapy, and that approved therapy is for an eye disease. So most of these patients get diagnosed. They have genetic testing, or they go into their physician and they're told they have primary mitochondrial disease. And then the physician tells them there's really nothing that they can do for them. So huge unmet medical need. And we're trying a number of different opportunities here to treat these patients. So our lead candidate is for adult patients that have multisystemic disease. So they're affected across multiple systems by primary mitochondrial disease. And then the second asset, NV354, is going to target children that have a specific type of disease called Leigh syndrome. And that's more that affects their brains. And so NV354 actually gets into the brain and helps mitochondrial dysfunction there. So two exciting candidates, both targeting different types of primary mitochondrial diseases.
How do you plan on growing your company?
Yeah, it's a good question. We can obviously grow the portfolio. So right now we have a late stage asset that's about to enter phase 2-3, and an early stage asset that's about ready to enter phase 1. We also have some other programs in the portfolio that we look to grow as well. So in 5 years, it's our hope that we have multiple programs, 4 or 5 running in the clinic. We'll also grow the team, obviously. As KO-1333 starts the study, we expect it to, if it's a successful study, we expect to take it to market. So you have to build a commercial team. That commercial team would probably be built in the US or Europe. And so the team will continue to grow as well. So I think there are lots of opportunities to grow here. PMD there's a lot of unmet need. And so we're really looking forward to addressing that from a number of different angles.
You just raised a new round of financing. Tell me more about that.
Yeah, thank you. We were excited to raise this financing. This is not an easy time to raise financing with the market the way it is. They say that the market is at the lowest level it's been in 20 years, and the deals that are being done are about 95% less than were done last year. So we were excited to announce our financing last week. We just raised a round of 200 million SEK, and that was comprised of both a directed share issue of 150 million SEK and a rights issue of 50 million SEK. Before issue costs. And the subscription price in both of those was 0.35 ora, which corresponded to a 10% discount. So that's a pretty good discount compared to what others are having to do. We're also excited because the raise is going to allow us to go to a key inflection point within the company. So this raise will allow us to run the first 40 patients in the study to the meaningful interim analysis late next year or early the following. So that's exciting that we've got enough money now to run KO-1333 phase 2-3 study, get NV354 to the clinic, and then we have 24 months of runway. So we were really happy to have that type of investment. I think it shows a great interest by the investor community in the company. And we were also excited to welcome some new shareholders. So IP Group out of the UK has joined us with this raise. And then Hadian, our lead investor and venture capital group out of Norway, continued to invest in us this round. So it was a good round. It was fun to have it done. And now we get to start the real work, I think.
What makes Abliva an interesting investment opportunity for prospective shareholders?
Yeah, it's a great question. I think that the share price is very attractive. It's quite low right now, and our valuation compared to US companies in the same space is quite different. So I think we're at about a 10x lower valuation. So it would be a good place to get in. I think we have a lead asset that's very competitive with the other lead assets. So all of us are about to have started a phase 2-3 study. So that brings us all 2 to 3 years from market. It's rare that you can get into a company at this stage, at this valuation. So I think that's the thing that excites me the most, or would excite an investor, is we could have revenue here in probably 3 or 4 years, which is pretty remarkable. One study away from putting the drug into NDA submission. So I think that's neat. I think the other thing about this space is there aren't a lot of us playing in it. It's not dominated by big pharma. It's dominated by companies like us. There are kind of two groups. There's some companies that are looking at systemic disease like we are, There are about 2 others, we're the 3rd. And then there are a group of about 3 that are looking at cognitive disease, like our NV354 program. And there are about 3 in that space too. We're all kind of in the same space. I think the thing that differentiates us from those others is that we are focused on this. We are focused on patients with primary mitochondrial disease. We design drugs to treat primary mitochondrial disease. The other companies have kind of happened upon mechanisms that they think might be effective in PMD. They were used for something else and they said, oh, you know, we might be able to make some money on PMD. Let's try it in primary mitochondrial disease. We actually designed our drugs. NV354 came from scientists associated with the company, and we designed that drug for PMD. So I think that's pretty exciting. The other reason, obviously, investors are interested in their return on investment, there's a big opportunity commercially with this drug. So KL1333, if you use pretty conservative numbers, it has over $1 billion in annual sales very easily. That's assuming a low premium price point in the US. And just because we don't know what premium pricing is going to do in the rare disease space over the next couple of years, we've assumed a conservative number. If you assume a less conservative number, the number gets quite big. So it's $1 billion in annual sales, even with conservative numbers. So that would get me excited as an investor too. So I think right now, I think we have a very good valuation to come in. I think we have an exciting vision. And I think that we have a real opportunity to make a difference in patients' lives and also have a big commercial win at the end of the game.
Thank you very much, Ellen.
Thank you.